The sympathetic and the parasympathetic nervous system are extremely important to understand, especially in the role of anxiety. As mentioned before, the sympathetic nervous system gets activated when we're in danger. It's a physiological response by your body, and it's pretty smart. Your heart starts to race. Do you know why? So you can get away from your predator. You start to sweat, and that's so your predator can't grab you. Your eyes, your pupils start to dilate. That's so you can see where you have to go. Everything that's happening in your body is real. Clients always say, this isn't psychosomatic. I'm not imagining it. You're not. But it's a false alarm when you're having an anxiety response. But remember, we are the descendants of people where there were saber-toothed tigers walking around. So if you have a strong sympathetic nervous system, in a way, you're the descendant of a very adaptive person. We always say the most relaxed person 2 billion years ago would be sitting by the campfire and would have gotten eaten up. Whereas if you have a strong sympathetic nervous system, and which has now turned it into an anxiety disorder, you're the one who was out of there quickly. You're very vigilant. The problem is there's no saber-toothed tigers now, and our body's adaptations have not caught up, which is why there are so many anxiety disorders. Now, I mentioned before there is, thank God, an opposing system called the parasympathetic nervous system. And here's some interesting information. The two systems cannot be on at the same time. So that really revolutionized psychology, cognitive behavioral in particular. Because if we can turn on the opposing system, which is the chill, relax system, by default, we can turn off the fight or flight system. So what we do is we teach strategies to clients. And one of the first ones we teach is a breathing strategy, which I'd like to tell you a little bit about now. When most of us breathe and we're walking through our life and we're busy, even now as I'm talking, I'm probably doing it, we are breathing from our chest. If you take a guess on what nervous system that is having an impact on, that's your sympathetic nervous system. So if I breathe too much from my chest, that's a sure way to develop anxiety. If you watch a baby sleep, they don't breathe from their chest, they breathe from their stomach. And that is actually how we're meant to breathe. So we teach a strategy that shows people how to breathe from their stomach. So I'm going to try to demonstrate this for you now and show you a little bit how it works. It's not going to be easy because I can't talk and breathe at the same time. So I'll give you the advance and then I'll demonstrate it. Number one, step one, if you want to practice this breathing strategy, please keep in mind the inhale will be through your nose. The reason for that is actually when we're taking in air and we're nervous, we usually take in too much air. So there's a bit of a misnomer out there that says when you're anxious, deep breathe. It is a deep breath insofar as it comes from your belly. It is not a deep breath insofar as you take a lot. So we're going to use the nostrils to make sure we don't take too much. So I will demonstrate this in a minute. So step one, the air has to come through your nostrils. Part of that same step is your stomach is going to have to extend. Okay, so I will show you that. So we want to go deeply into the diaphragmatic breathing. So it looks a little bit like this. If you try that, you almost immediately will feel differently. But we actually ask you to do it for 10 breaths. So a repeat. Inhale through the nostrils, stomach coming out with the inhale, which is not what we usually do. Exhale through the mouth and the stomach going back in. This soothes your nervous system and brings you to a parasympathetic system response. Are you going to be able to do this in the middle of a panic attack? Maybe, maybe not. So you need to practice this before you're in anxiety. So I'll show you again what would happen if you did this throughout a few breaths. You would put your hand on your stomach. You would inhale through your nose. You may have noticed the exhale is longer than the inhale, and that's because when you're anxious, you actually need to exhale, not inhale. This is what a lot of people do not know. So if you try this now, even as you're watching this, you will notice, and I'll do 3 breaths with you right now, you will notice immediately you start to feel more relaxed. Let's do it together. Keep in mind when you're doing this, the count on the inhale is a 1, 2, 3 count. The count on the exhale is a 1, 2, 3, 4 pause. It's slow and regular. If you do this exercise and you feel dizzy, you are inhaling too much. It is a good way to practice to slow down your breath, and it's something I use every day when I'm in a difficult situation. Of all the hundreds of clients I've treated over the years, nothing has had a more profound effect on reducing anxiety quickly than the breathing technique.